Hey everyone, welcome to RegenMed Global, the podcast. In this episode, we will be discussing the development of a blood test that can potentially detect cancer a year before it forms. Leading this development, we have the CEO of Tzar Labs, Ashish Tripathi. Ashish, really appreciate you taking the time to connect and thank you for joining.
Shine, it's such a pleasure.
Uh,
I'm happy to be here. Thank you so much for inviting me.
Thank you. Before we get started, can you briefly tell us a little bit about your
So,
background?
Shine, I actually come from an investment banking background. I used to work in the US, UK, and Australia for a very long time. Came back to India and worked with three of the largest investment banks here, Avendus, EY, and then the largest Edelweiss, where I was the national TMT head. Actually, the scientist behind this was my father. When I raised money for his firm, the investors insisted that they wanted me to join as the CEO because they said, look, there's a key man risk here and this will need international capital. That's how I got into this firm and into this role back in 2016. And looking back, I'm glad I did because the reality is, when you're working in another company, and standing on two boats, you never understand the technology in as much detail as you do when you are actually standing in one boat, right? So I'm glad to have actually joined the firm and learned a lot, and here I am.
Excellent. Can you tell us a little bit about kind of what you guys' company does, Tzar Labs?
So, Sharon, there are three global firsts that we claim. This is the first pan-cancer blood test. It detects every cancer. Remember, there are 200 types of cancer, 3,000 subtypes of cancer. We can detect all of them, but interestingly, we detect it when it is still PET negative. That's actually stage 0, not stage 1. At this stage, from a blood sample, we can tell you which cancer and where it is growing straight from a blood sample. That's claim 1. Claim 2, this is the first prognostic test for cancer. From a blood test, I can tell you do not have cancer, but more interestingly, I can tell you that you're not at risk of cancer for the next 1 year because we know the pace at which these markers grow. So if it's within a safe zone, we know that the fastest cancer can't go from here to a tumor stage in 1 year. So you can understand the use case of a test like that. It's like a blood test that all of us have to do once a year, and we either catch cancer at stage 1 or before when it is infinitely more curable. But the third claim, and that's useful for oncologists, we can actually give you the mutation dysfunctional pathway readings that you get from a biopsy of a tumor tissue, but we can give it to you from a blood sample itself. Now, this is useful because that actually dictates what kind of therapeutic interventions and actually measuring response for oncologists. So this is what we claim, but that said, I've been on the public domain now for some time, and I've actually stated that the reason we made this breakthrough was because we were lucky enough to, we were actually a drug company that was working on a cancer drug. And while studying the pathways, we realized that the drug was acting on a small population of stem cells. And when we delved in, we realized the stem cell gets an epigenetic change, which creates cancer stem cells. Cancer stem cells create cancer cells. Then a billion cancer cells come together and start to shed, and CTCs and ctDNA. Effectively, every liquid biopsy company was looking at this, while we stumbled on positive.
Can you tell us about like which cancers can be detected with this test that your team has developed?
So that's a good question. Incidentally, our clinical study that got published, the one that we did, 1,000 patient study in India, that contained 25 different cancers. Till now, we have done these tests on 50 different types of cancer, and we've been able to detect all of them. But the point is that please understand that cancer is complex. There are 200 different types of cancer, 3,000 subtypes of cancer. We believe that this detects every type of cancer, and the reason is because the cancer stem cells actually are causative in all the types of cancers, as per how we understand cancer. Having said that, we will probably have to do clinical studies on all the types of cancer before we can make that claim.
Is there a particular biomarker that's kind of being measured in this test, or can you tell us about kind of how it's ultimately measured with this blood
So we
test?
have actually put out a biomarker in the paper, but for full disclosure, we specifically look at nearly 10 to 15 markers in the HRC marker test because we want the high sensitivity. But the one that we have put out in the in the public domain is OPT4, right? Having said that, we look at others as well because that's what gives us accuracy for multiple cancers.
Is there any blood work right now that can do what your team is doing or close to what your team is doing right now?
So look, we keep an eye on competition. The reality is that the unique position that we are in, and we just got our US patents granted. The reality is that most liquid biopsy companies, in fact, all that we're aware of, have essentially been looking at these tumor bits, CTCs, ctDNA, and cell-free RNA, all tumor bits that come from the tumor, right? They're broken off pieces of the tumor. Now, essentially, we're not aware of anyone that is actually looking at a causative marker in stem cells. And the reality is that that actually, by our analysis, is showing up in the blood a good 12 to 18 months before the tumor even forms. But the best part about it is that we get a reading for non-cancer because it's a natural cell. So, unlike a tumor based approach where the absence of tumor cells is indicative of non cancer, absence of evidence is not the same as evidence of absence. We get a reading for non cancer. And that is perhaps the reason why we're getting the high sensitivity. But in answer to your question, we aren't aware of anyone else that is looking at a causative marker.
What is the current stage of this development right now?
So we have clinical studies going. Our Western clinical studies going on right now. We have two clinical studies going on with NHS, and we are in fact negotiating with hospitals and institutions in the US as well, and including with NIH to start our US clinical trials. And we expect these clinical studies to come, the results to come in, next year. And our view is that once we have got that, there's going to be a significant amount of conversations on our technology. Because look, our first study was done in India, and as a number of bulge bracket funds have said that they would like to see Western ratification data, and we're glad to do it because Western studies put you through certain rigors, which we think is in our all our best interests. So that's the study that we're focusing on right now. And like I said, by the second half of next year, the first half of next year, you should actually have those results.
When do you think something like this could be widely accessible to patients if they want to go ahead and test?
So interestingly, the product has already been launched in India because look, the breakthrough was made by Indian scientists, and we've already launched the services. So we've taken the requisite permissions, but we have already launched the service in India. We are currently doing the NHS trials, and the advice given to us by NHS is that do it cancer by cancer, because if you make it into an all cancer test, then the clinical study needs to be a lot larger, and hence we are actually doing it by cancer. And we expect to have the results, and then we'll probably look at getting into an accelerated path. Having said that, we've already been approached by labs both in Europe and US to launch it as a private service because it's the need of the hour. I mean, the challenge with cancer is that if you don't catch it early, it's particularly it's a bad outcome. And this particular test, it's a non-invasive test. It's just a blood test, but it covers for so many cancers. For full disclosure, we claim the cancers that we have tested on to date, but that said, theoretically we know that it works on every cancer. So my earlier answer was related to how we see this particular technology developing over time.
Say if someone's able to detect it, it shows there's something that could form or is forming. What is this able to do? Is this basically helping be proactive with treatment, or is there something that could be done to prevent the cancer from forming?
So we are not into intervention right now, right? But we do believe
Okay.
we are in fact in talks with biotech companies because we feel that if you can measure it over time, we will work with companies that can intervene, with milder forms of treatment. But we also believe that there will be a lot of drugs that can be repurposed to actually address the cancer at that early stage. Having said that, our job is effectively a risk evaluation for the simple reason that we want to actually detect cancer at stage 1 for as many people as we can. Because if you just look at the statistics, I'll just quote one study that was done for lung cancer, I believe, in Europe, where they said that if you can detect the cancer early, they didn't define early, but I'm assuming stage 1 and stage 2. But they said that if you can detect it early, the cost to the patient was £5,000, and the chances of survival beyond 5 years was 95%. And if you got it late, they didn't define late, but stage 3 and stage 4 is what we assume. They said that the cost to the patient was £150,000, and the chances of survival beyond 5 years was 5%. Now, so there's a real cost, right, to detecting this disease late. And what we are trying to solve for
Right.
is that if everyone is doing this test once a year, we will catch that cancer at stage 1. And that is a wonderful goal to have.
Could this open up avenues for being able to detect other types of diseases as well using this blood test, or just opening up further studies towards an avenue like that?
Look, to be honest with you, we do believe that it will actually work for other diseases as well, especially stem cell based illness. But the point is that our immediate focus right now is cancer, because look, that's a big enough task, and the reality is that it's a complex disease. So we first want to prove it on a number of cancers, but over time, yes, we will work on other diseases as well.
Sheesh, are there any other kind of final thoughts or anything else that you'd like to go ahead and share that you think is really important for people to go know about this development?
So if I can state one thing, for anyone that has actually had this disease in their family, this is a particularly horrible disease. It's either the number one or number two killer in most countries. But I think that statistic doesn't do it justice. The reality is that the kind of pain that it causes the patients, their families, and the system at large, it's horrendous. And in our view, the only real solution is early detection. And the challenge that you have is that there are tests, like for example, if I have colon cancer in my family and I do a colonoscopy regularly, that will actually detect colon cancer. But 5 years down, I may actually get brain cancer, and a colonoscopy will not detect it. The beauty of a multi-cancer test, right, is that it can be one test that you actually do to cover for multiple cancers, and that is essentially what our aim is. We also believe that cancer is actually a weak disease so long as you catch it early. The challenge is that we detect it so late that the chances of survival are low, right? And we believe that if we can actually just solve this problem, we will save a lot of lives, and that's something that we are focused on. But as I said, our immediate focus is actually trying to get the clinical studies out of the way, Western clinical studies out of the way, and we do want to make this available to as many people as we can in an affordable manner.
Ashish, this is amazing. Thank you so much for all this information you're sharing with us, and wishing you all the best.
No, it's a pleasure, Sharon. We've been planning to catch up for some time, and I'm so glad that we could make this work. It's really a pleasure to connect with you.
I, likewise, truly a pleasure. Thank you.
Thank you.